Well, if you're eligible for VA, TRICARE, or CHAMP VA, you definitely want to pay attention to our show this morning. We have in studio with us Lisa Ladner with Lisa Ladner Health Insurance Agency in Diamond Head, and also Cullen Wright, and who is going to talk about the importance of getting yourself signed up for this if you don't have it yet. Lisa, if you would, tell us a little bit about yourself and about our special guest.
Thank you. I'm Lisa Ladner with Lisa Ladner Health Insurance Agency, and I have an office in Diamond Head and one in Biloxi. And I'm here with Cullen Wright. My parent company is Advocate Health, and he is the Veterans Initiative Director for Advocate Health. He's a retired Army Colonel.
Well, thank you very much for your service, Cullen.
Very welcome.
If you would, tell us a little bit about your relationship with Lisa and her agency.
As Lisa said, I'm a retired Army Colonel, and I love what I do. I work at Advocate Health Advisors, and I still get to serve in that capacity. We work with nearly 70 different healthcare carriers in the Medicare space across the country, and I love what I do because I get to help with local experts like Lisa that we train and certify on the fusion of our military benefits with VA or CHAMP VA or TRICARE, whichever the one is using. And I'll brag on Lisa a little bit. There's only about 350 agents in the nation that have been through our program and have become certified, and Lisa has one of the highest concentrations here. She has her entire team of 6 certifications here, so it's probably one of the largest concentration of certified agents in this piece.
Well, that's great because we have a lot of retirees that live down here now, the snowbirds or whatever,
oh, yeah.
But they come down here and they retire, and when they become eligible for these special benefits. Tell me a little bit about the earned health care benefits that a veteran's or a veteran's spouse may receive.
Sure, and there's actually 3 buckets of military health care, and they are earned benefits. You have VA, it's probably the largest. There's eligibility and qualification criteria for that. Eligibility is pretty much time in service. Qualification can come in a lot of different variations of either service-connected disability or income, or there's 8 priority groups. And then a smaller group, a subset of that is CHAMP VA. It's given to spouses of veterans who have either passed from complications with a service-connected injury or they've been declared 100% permanent total. And then the medium-size bucket is TRICARE, and that's given to retirees. They've either medically retired or they have done 20 years of service, and it's a retiree benefit.
Okay. Can you lose your TRICARE or your other earned military benefits at any point?
No, and this is actually something that holds true across the entire spectrum of these. These are awarded for factual life events that can't be undone. If you have TRICARE, you did 20 years of military service.
Right.
That is a lifetime
My
award.
father had that because
Absolutely.
he did 20 years Air Force. So.
Absolutely. I bet he never lost it either.
No, he did not.
Yeah, no, there's a lot of misinformation in this space. It's pretty much what I've dedicated the last 8 years of my life to. Is I don't think I've found another segment of anything in my life where I've found so much bad information that's out there. But no, you can't lose those benefits.
Yeah.
In the Medicare space, you do have to pay your Part B premium and live and breathe, and it's still intact.
Well, I have to tell our audience that Cullen came all the way down here from Charlotte to share this information with us and everything. So, and I know he's worked very well with Lisa and her group for a long time. Why would a veteran or their spouse want to add a Medicare Advantage plan to their health care?
Well, you have, out of those 3 different buckets, you kind of have different itches to be scratched for each. For the VA, and this is not true for all VAs, but you may have someone that wants something a little closer or quicker. They may want to see a specialist of their own choosing because not every specialist in the community works with the VA. They may want an outside second opinion. So those are kind of the itches, I say, that we scratch for our VA members. We don't look to replace anything at the VA. We only augment the things that they don't offer. For example, 10% of our veterans at the VA get dental. Dental is a huge item that's available out here for our veterans, so they like that. And TRICARE and CHAMP VA, they're sort of cousins in the way they perform in the Medicare space. They don't come with anything other than the promise to pay the rest of the bill and a drug plan. So if you want any of those extras that you'll see, and you see the commercials all the time, dental, vision, hearing, Part B give back, and the list goes on and on.
Right.
You have to get the original Medicare piece out as your first payer, and then that military benefit's not going anywhere. It'll be there as that second payer, and then put in an Advantage plan that has these benefits in it.
And I'm sure there are a lot of people that are watching that are eligible for these any of these plans that are probably wondering which plan is best for me, because they may not realize. I mean, out of these the VA, the TRICARE, the CHAMP VA, which one would be a better plan for their needs?
Yes, and they vary by market, and not all of our agents represent every plan in every market. These plans can be built on something as small as a county level to a statewide plan. So that's why we really stress, not to buy this from some anonymous voice on the other end of a phone call, to buy from your local expert. They know the doctors, they know the pharmacies, they know the networks. So I can't stress enough to buy local, and I can't stress enough to buy from someone that, if you're a veteran, that's been through our certification like Lisa and her team.
And you see all these these celebrities that are pushing, you could call these 800 numbers or whatever to, for things like that. But then again, if you're going to do something like this, you want somebody like Lisa and her agency that are local. I mean,
Sure.
you said you have an office in Diamond Head and one in Biloxi, that if you have a question, you don't know who to reach out to with everything like that. We have a couple minutes left. What are the time frames for veterans and their spouses to make these decisions, and are there any exceptions?
So a veteran can sign up anytime during the year. So it would start the first of the month, the following month that they sign up, but they can sign up anytime during the year.
No, that's
They get a special exception for one type of plan. Not a lot of veterans know that. And the government's basically given us this special enrollment period if a veteran gets their prescription medication through a military source, VA, CHAMP, VA, TRICARE, and they have obtained that in the Medicare market through maybe a prescription drug plan or a Medicare plan that has prescription drugs, and it's viewed as unnecessary because you have coverage just as good as Medicare, you can change that plan anytime throughout the year. So they do get a very neat opportunity, and the SEP was designed just for veterans.
Well, if we have any veterans or veteran spouses out there watching the show this morning, what would you encourage them to do?
You have to make an informed decision, and no matter what your decision is, make that decision with the accurate and correct information. There are a lot of phenomenal insurance agents out there that do a great job. The ones that I can say I know for sure because they made 100 on our certification process, or Lisa.
We have to take a test?
Oh yes.
We have to take a test.
They go through a
Yes.
training, they have to be
certified.
nominated.
Yeah, sure. And I'm just
Yeah, we
joking.
are.
I can understand that.
Yeah, we put them through a certification process, and they have to get nominated by their regional manager and director. But if they have been through that process, I know that they're not going to get it right by accident. They'll get it right by design and training and certification.
Well, Lisa, Cullen, thank you so much for being on the show
Thank you
this
for
morning,
having us.
for educating those folks with, if you're qualifying for VA, TRICARE, or CHAMP VA. Numbers on the screen there. You can call and set up an appointment with Lisa and her agency located in Diamond Head and also in Biloxi. Lisa Ladner Health Insurance Agency.